Good morning. My name is Scott Haldeman, and I've been involved in the spine world for most of my career. I've got to tell everybody who's watching this that this is the most exciting and important time in spine research and spine delivery of spine care in the world. I'm currently on faculty at the University of California, Irvine Department of Neurology, the University of California, Los Angeles in the Department of Epidemiology, the Southern California University of Health Sciences, and the Ontario Institute of Technology. I'm also president and chair of the World Spine Care Organization. It is a charity organization, has clinics in Botswana, Dominican Republic, India, and Ghana. And I've recently chaired the Global Spine Care Initiative, which was a scientific project to review the scientific literature and come up with a new model of care for the management of spinal disorders, and which is based on scientific research currently available. The Global Spine Care Initiative had 68 clinicians from 24 countries that reached a consensus on what the evidence shows concerning the best manner of treating people with spinal disorders. For those who are not fully aware, spinal disease, pain, particularly low back pain and neck pain, are the #1 cause of disability in the world. They have a greater burden on society than diseases such as diabetes, heart disease, Alzheimer's disease, and other disorders, including HIV. It is also one of the most costly conditions affecting society, in that the cost of managing spinal pain is now in the neighborhood of $86 billion in the United States. What I'm hoping to present at this meeting is a discussion of the Global Spine Care Initiative, the current research on which it's based, the model of care which has been recommended by this large group of clinicians and scientists from around the world, and the nature of what the role of a primary spine care clinician might be. It is generally recognized now that prior approaches, including a high pharmacological, including opioid approach to spinal pain, and an emphasis on surgical intervention is not working. And the current scientific research focuses on the non-pharmacological, non-surgical approaches, which are valid for about 80% of the patients who might present it to with symptoms related to their spine. The use of pharmacological and surgical interventions are only for a small portion, which are becoming increasingly well-defined. Since most people with spinal disorders can be managed with non-pharmacological, non-surgical approaches, we're talking in terms of education of patients about the nature of their problem, exercise programs, including Tai Chi and yoga, amongst others, and the manual therapies, including mobilization, manipulation, and to some extent massage. This is why I believe that chiropractors have a lead role in the field of trying to reduce the burden of spinal disorders on societies throughout the world. And since they are probably better trained in the management of spine disorders than any other single healthcare professional. And it's going to be up to the chiropractic profession to decide whether they want to assume the central role as the primary spine care clinician in trying to alleviate the burden of spinal disease in the world. Thank you. Looking forward to the meeting.